Hi, I'm Dr. Robert Dean. I work with ARO, and I'm here to talk about hip pain and what may lead you to needing a hip replacement surgery. A total hip replacement surgery is a big operation and a very good operation if done appropriately. What causes you to have pain that's severe enough in your hip that makes you want to go and have a large inpatient surgery? Well, people function, people run, people walk. People like to do their daily activities, but at one point your hip, which is a ball and a socket, the cartilage that coats that ball and socket, which is a hard Teflon-like cartilage, it wears over time. And if you've ever had any injuries, say you've fallen or you've had an accident, or you may have even had other things from athletics or life, straightforward degeneration, you can wear some of that hard cartilage as protecting the ball and socket, leading to little potholes, as you can see here, little divots, little worn spots. Why is that important? Because this hyaline cartilage is like Teflon protecting the bone underneath. The bone underneath is alive. It has nerve endings, it has blood vessels. When you don't have the protection over those nerve endings and you put pressure on that nerve ending, it hurts. So when your orthopedic doctor looks at your x-ray and says, oh, you have a little narrowing here on this side of your joint, you're bone on bone or almost bone on bone, what they're really implying is that you've worn out some of that hard Teflon-like cartilage and you've got an area of thinning on that x-ray that's suggestive of these nerve endings being exposed. The only surgical treatment for that is to cut out the joint and remove where the nerve endings are. That's what a hip replacement is. Sounds like a big surgery for a very simple problem, because it is. So the question is, what are the alternatives or what are your other options to having a hip replacement surgery? Because remember, surgery in a hospital has intrinsic risks associated with it, but a total hip replacement doesn't last forever. It's not a bionic hip. You're not going to be running at 50 miles per hour. It lasts about 10, 12, maybe 15 years. And that's per the package inserts from the people that make these implants. Now, if you have wearing and tearing of that cartilage, and you're walking around and you're not using a walker or a wheelchair, then your chondromalacia is the medical term for potholes in that hyaline cartilage. And remember, this hyaline cartilage we're talking about, this Teflon coating, this is the same stuff you see on the tip of a chicken bone. So when you eat chicken, that hard white rubbery cartilage that's on the tip of the chicken bone, that's hyaline cartilage. So what you've done over time is you've worn out low areas or little divots or potholes in your chicken bone cartilage. And then the nerve endings underneath don't have the protection, so when you put pressure on that, it hurts. So if it's a problem when you walk, you may change how you walk. You may limp, you may shift a little to the left, may have a hard time getting out of the car. It all depends on the torquing and the pressure put on that low area. Steroids, anti-inflammatory medicines, these are things to reduce the swelling inside the joint, because what we don't realize as patients is that the pain you're feeling is a symptom, but the pain you're feeling is actually perpetuating the inflammation and the inflammatory proteins inside of the joint. Those nerve endings are actually stimulating more inflammation because your body's trying to create a cushion so that you don't keep hitting that pothole. Well, your hip is an encapsulated joint. There's a capsule around it. So as that fluid becomes more and more full, it becomes tighter and tighter, and that in itself will push on the nerve endings, and you'll have this chronic arthritic pain, stiffness, change in mobility, because now your muscles are adapting and shifting to try to protect you from hitting that pothole. When you have a replacement surgery, you're removing the whole thing and putting in this implant, voila, the nerve endings are gone. And that's how joint replacement treats hip pain from chondromalacia. If that ball joint is still round, if it's still articulating, if it's still functioning, and there's just a little bit of narrowing or a little bit of chondromalacia or thinning of that cartilage, that's a really big surgery just for joint pain. However, it's something that is basically pitched as a very simple solution to your problem. It's hospital-based, it takes a few hours, 6 to 8, 12 weeks of rehab afterwards. Obviously, there are risks of infection and other complications because of anesthesia. Again, in the right scenario, say this nice round ball joint is collapsed, fractured, there's a giant bone spur sticking out of it, you just can't function mechanically. If your joint doesn't work mechanically, then a joint replacement surgery is going to make your life amazing. If your joint is normal in appearance as far as the articulation of the joint and there's narrowing of this cartilage, well, you need to call us, because at Arrow Motion we do other procedures that complement this problem to help you solve this problem of chondromalacia, nerve pain, and inflammation in your joint so you can keep your joint and not necessarily have it cut out and replaced.